things have changed rapidly during the day with the situation in Victoria. And so a couple of hours ago, I declared the 7th time this has happened a Commonwealth hotspot for Greater Melbourne. The reasons for there are it has actually reached that definition of concern from the Commonwealth level, and in terms of rapidly increasing numbers of cases, but more importantly, rapidly increasing, particularly overnight, with almost a doubling of the number of contact places, and some of those are at very high risk in terms of transmission. The other important element of the situation in Victoria is this is one of the designated World Health Organisation variants of concern. This is related to the outbreak that's happening in India right now in terms of a more transmissible virus, and so that is that link with the case that had come out of hotel quarantine in South Australia, had travelled to Victoria a few weeks ago now, and all of the genomic analysis so far has led to that's probably where this outbreak has started. They haven't made that epidemiological link directly and clearly back to that first case, but all of the other cases have been epidemiologically linked so far in that now 2 outbreaks in Melbourne, as well as those links into the rural parts or the regional parts of Victoria. So we have declared a Commonwealth hotspot. What does that mean? Well, it really just does activate some of the supports from the Commonwealth, particularly in relation to single site support for aged care facility staff. So that is a particular thing that is activated from today. But really over the last couple of days we have looked at what other supports we could be giving to Victoria. Each day we've had a emergency AHPPC meeting since those first cases were identified a few days ago now, and all of the Chief Health Officers and myself have offered all of our supports, both materially and of course from just a general professional support to our colleagues in Victoria who are dealing with this outbreak. We've offered personal protective equipment to Victoria. They don't need any more at the moment. They have plenty. We've offered extra vaccines, and my colleague Commodore Young will talk to that. We've reactivated, although it was continuing to be there, the Victorian Aged Care Response Centre as part of our combined Commonwealth and state response, particularly in relation to aged care, and so that's being scaled up again in the context, in this new context, and we've also offered support with the contact tracing if that was needed. Currently, we've been told that isn't the case. So that is the main issue to discuss today, the hotspot definition. Just in terms of vaccine rollout in Victoria, and again my colleague Commodore Young will talk to the actual numbers, but I've said many times from this podium and other podiums, please get vaccinated. If you are in the groups that are that is available to right now, and the Victorian Government has increased some of those groups today, and that's their prerogative to do so in their state-based clinics. We really, this is the time, and this is the main incentive I talked about on Monday for getting vaccinated. It is to protect yourself, to protect your family, and to contribute to the protection of the whole community here in Australia. So please, if you are in those groups that are where vaccination is available right now, please make that appointment and get vaccinated. Finally, in relation to quarantine, because there's been a lot of discussion around quarantine in the context of the Victorian outbreak, we continue, and again today at AHPPC we had a discussion amongst all of the Chief Health Officers about hotel quarantine and quarantine more broadly. We continue to learn from the issues that have arisen every time we've had a breach of quarantine, of which there have been several, but not a lot in the context of how many people have gone through hotel quarantine since last year. And we had another discussion around that again today. Yesterday, the South Australian Chief Public Health Officer, Dr. Nicholas Spurrier, did table that or announce that report had been completed into the latest breach from South Australia. There are more things to learn there, but in general terms, I would say, like every outbreak that we deal with in infectious diseases, and I've been doing this through my entire professional career, there are multiple things that happen in relation to outbreaks. Some of those are due to the environment of where that outbreak commences and spreads. Some of those are due to human factors, including human behaviour, and some of those are due to the virus. And what we learned from this particular breach from hotel quarantine touches on all of those things, and so it's important for us to learn from those to see what we continue to do to improve quarantine, but hotel quarantine remains essentially safe.